Welcome to the Low Carb MD Podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD Podcast. Tro, how you doing, man? We're on our game today.
I'm doing great. I'm doing so good. Super excited, super excited. A lot of cool things coming to fruition. I submitted, I'm crossing my fingers. I submitted a paper, waiting on that. We have two amazing small groups where we're focusing on, 8 to 10 people. And our coaches, have that coming up in 2 weeks, which is really awesome. And I have been working on a type 1 consensus statement, a type 1 diabetes consensus statement, or position statement from the SMHP. And that's nearing, being finalized, and that's getting ready to be submitted. Just a lot of exciting stuff. And then, after this small group gets started in July 27th, we have, super excited 4 speakers talking about the weight loss mindset, which I know you've been wanting to talk about too. So a lot of stuff. And then today we have an awesome guest, somebody I've worked with now for the last 6 months, somebody that's really super excited about. And this interview has been a long time coming, probably too long. Today we have Reid, and I know, first of all, she has more qualifications, I think, than I have at this point. The amount of certifications she's had, like, food addiction, metabolic health practitioner, nutrition network practitioner. I mean, really just who's done a deep dive after her own journey. And when she first told her journey, Brian, I got to be honest with you, I was like in tears. And it just, was such an inspiring story of somebody who's just literally, coming out of, and I'm careful about how I say this, the shackles of sort of modern medicine. You and I know, Brian, like people end up on, you get to like, I don't know, 40, 50, 60, and then you look at, and you're on 20 medications.
Yeah, and another medication for the side effects of the first one, and that one you don't need anymore. And it is unbelievable. And how many people are just told by their doctor, you can never come off this medicine. If you ever come off it, you're going to die. And so they're afraid to come off it now, even if you say, well, you don't really need it. Your sugars are under control now, or whatever it is. And I'll say, Troy, in my little behind the scenes, Tia, I ran into her at Boca Raton, and she was so super nice in the lobby of the hotel. And I'm like, oh my gosh, if everyone's this nice, this is going to be the best conference ever. So T was just so kind and decent, and so it's nice to be surrounded by good people. And then I hear she joins the dark side with Tro, and I've been heartbroken all morning now.
Oh, we're the light side, man. This is the light side.
No, you're doing some good work. You surround yourself with great people. You don't have to be smart, Tro, if you got good people around you. So you're lucky, man.
I have amazing people. Her story is going to inspire everybody, and I can't wait to hear more about it today. And the small group that her and Amy Igus do, it's just amazing. So if you're listening to this and you're looking for extra help with just, 2 awesome health coaches who live the journey, we'll put in the show notes maybe on how to get started.
Yeah, I hope we get some more joiners. It's a great program, and I am inspired by the people that join.
Yeah, me too. So Tia, can you walk us through, I've heard parts of the story before, you're a mom, you're a wife, you're going through a lot. I mean, how did you even get to the point where you're like, wait a second, something is wrong here. Maybe these 20 medications are not needed. Maybe there's something else. How did you get to that? Like, can you walk us through getting to that point?
Yeah, thanks for one. Thank you for having me on to share. I feel really honored to be here. But I tell you, the beliefs that were installed in me from the medical community were just like crazy. Like I'd never get off insulin. I'd never get off my statins or my blood pressure medications, and that it was just the cards I was dealt, and I would have to deal with them and medicate for my symptoms. And it just I mean today I feel so angry sometimes about it. I can't believe, I trusted my docs I went to. I even went to Centers for Advanced Medicine hours away. And it just affected my life, everything, physically, biologically, spiritually, financially. But my family was very concerned and couldn't believe how much, I had deteriorated just from ages 30 to 40. But I feel like it kind of started with gestational diabetes with my second pregnancy. He ended up being 11 pounds, but they didn't catch it till the end of my pregnancy. And I know now that within like 10 years, you could have full blown diabetes if you don't change your ways. And no one ever said, hey, you need to think about your eating plan. What are you eating? What does your nutrition look like? Because you don't have to have type 2 diabetes. It doesn't have to be chronic and progressive. Well, so that went on, and eventually 10 years later, I got very depressed along the way because I started gaining so much weight. And I had been thin by nature all my life. Anyway, my type 2 diabetes did get out of control, ended up needing insulin pump titration. I was hungry all the time. I didn't know how to deal with social situations. So I was, I just would stop going to events. I'd stop going to family events. Next thing you know, I needed a CPAP for sleep titration, had a sleep study done. And I just felt like any day I might die, and no energy, low fatigue, fatigued all the time. I isolated myself. And sometimes I couldn't even walk for very far. I'd gotten up to about 250 pounds. And, my family said, hey, you need to get a handle on this. I thought I'm never going to see my kids get married. I'm never going to, go to their weddings. And hey, I got to go to my daughter's wedding. So I'm really excited about that. And I have a second grandbaby on the way. So that is exciting too. But awareness really is everything. And I had to change my thought process and my beliefs and insights. I had to take on new beliefs, which required new processes, new thinking, new ideas. But I ended up going to a low carb doctor, and he said, I think you have a carb addiction. And I'm like, what are you talking about? You have to have carbs to live, right?
Hold on. Well, how did you even get, that's a big jump, right? So you sound like you were struggling, and, what did the doctors at the time say? Did they say, you need to focus on diet? Did anybody even talk about diet? Did they say
Never.
Processed food, or they're giving you insulin, they're giving you drugs, and I mean, I just
skipped a whole lot. I skipped a whole lot there, didn't I? I mean, another thing I got told was I had non-alcoholic fatty liver, and that I had a fatty tumor in my liver, and not to worry about it because it was fairly common and a lot of people had it. Knowing what I know now, that chances are if you get diagnosed with fatty liver, hypertension, and type 2 diabetes is next. And I could have, gotten a handle on it then. So that's very aggravating as well. But, I had my gallbladder removed. I had lumps in my breast that had to be removed. I had been diagnosed with Cushing's disease. Then they found that there was a tumor in my adrenal gland. So I had to have a right adrenalectomy. It's just like one thing after another. I couldn't believe it. It was like unbelievable. And then 3 grapefruit-sized tumors in my uterus and had to have a radical hysterectomy. Yeah, I was just so depressed, I couldn't believe it. And then the next thing you know, I have a large kidney stone stuck in my ureter and went septic and had to be choppered to St. Louis. And they even told my kids and family came in, they didn't know that if I was going to make it. I really did think I was going to die that time. And when I got out of that, luckily I got out of that, and I was able to heal, but the GERD was unbelievable. The acid reflux after that, it was like water, just drinking water even gave me reflux, and I was in chronic pain. So every time I went to the doctor, there was another pill. I just couldn't believe how many medications I was on. I don't know if you've, should you want me to list the medications I was on? It was incredible.
I think, it just sounds like these docs were just sort of treating you and not really thinking, okay, what is actually going on here? They're like, okay, you got reflux. Here you go. Here's a reflux med. Oh, you're in pain. Like, here's, take a fibromyalgia pill. Oh, you got depression. Here, take this pill. And, is that what was happening? Like they were helping in this convoluted way by just giving you a pill for each problem.
Well, yeah. And I ended up going to, a diabetes center, and a great diabetes center that I thought was the best. And, what I was told to do was eat 46 grams of carbs per meal 3 times a day, 15 grams of snacks 2 times a day, and never go 4 hours without eating, and give myself a bolus, and that I could eat in moderation whatever I wanted. So, I'm giving myself, besides the insulin pump titration of up to like 200 units a day, I had a 50 units of Lantus at night that I was giving myself a shot. And I just got sicker and sicker. The more I went, the sicker I got.
And what made you say, well, wait a second, I wish the SMHP existed at that point, but
I know, me too.
You could have found the doc, super quickly, but what made you say, I need a different type of doc?
Well, after I visited some family in New Mexico, and they just couldn't believe it. My cousin was starting out in some pharmacies, no longer in it, but he's like, Tia, this isn't right. You shouldn't have that many medications. And he looked up some of them, and he's like, you're taking double statins and double, I felt like I was 80 years old. I couldn't even walk up the stairs. My light had shined, my light was gone. All I wanted to do was come home and sleep at night, and then I'd get up and eat, and I'd go back to sleep again.
How did that affect your relationship, like family, friends, marriage, those kind of things?
I was isolating myself so much that it put a damper on everything, even me and my husband's relationship. My kids wanted me at their events, and I even missed a Christmas one time because I knew that I wanted to eat. So I knew if they all left, I could eat what I wanted. Because I just had it in my brain that there was no hope, that this is the cards I had been dealt, and I would sneak, lie, and hide as much as possible. I would stop at a gas station on the way home and eat before I would make supper at home, and then eat again. It was just like continuously overeating.
Yeah, and that's the thing we hear so often. People will say, it's so restrictive and it's so difficult. It's like, what's difficult is being starving all the time and hungry all the time and thinking, how can I get food? And, like you're saying, how can I send my family away so I can eat what I want to eat without anyone monitoring me, or eating in the car, or all these things that people don't realize. Like, one thing that Tro and I have seen in our patients is this new freedom where they say, I skipped lunch yesterday and I was even hungry and I felt great. I didn't have, You know what I mean? Before, if you like, some people come in and they go, I'm never going to skip a meal. If I do, I'll die, you know, because it's so scary to think about it. Because a lot of people, they wake up in the morning, like, what are we having for lunch? What do we have for breakfast? What are we having for snack? What are we having for dinner? What are we going to do after dinner? And it's so hard to be, that's so restrictive for people.
I know, it's like when you're eating one meal, you're planning for your next.
Yeah, while you're still eating it, right? You're like, okay, after this,
Yeah,
when am I gonna eat
yeah.
again? And especially when it's beaten into your head that you have to eat every 3 or 4 hours and you always have to eat these carbs all day long. And now you're taking extra insulin to get rid of the carbs we're giving you. And no one sits back and says, does this make sense at all to anyone?
Yeah, I don't know. But finding this way of life has been so freeing, and the guilt and shame was unbearable at times. Being, I was told at one point from one doctor that I just didn't have any willpower and I needed to suck it up. And I had another one tell me, it's just hard.
How did that make you feel? I'm just curious, like
Um,
you need to do better. You need more I've been having some very, engaging discussions online about this topic, and elsewhere. Like, what did you feel when the doctor was like, you just need more willpower, you just need more discipline?
I did.
Was that
know,
true?
where was I supposed to get that from? I don't know. I don't know. Is there, can you buy it at the store? Because I didn't have any left. I had tried everything, I tried it overly exercising. I tried, moving more. I even tried half marathons when I was way too heavy and I did terrible damage to myself. It made me feel horrible. And the next thing you know, I'm on the maximum amount of Cymbalta, and that didn't do it. So they added Wellbutrin. So now I'm on two medicines for depression. And those were hard. That was a horrible thing to get off of, Cymbalta. Some people may not have trouble, but I really had a hard time getting off of it. Yeah.
I mean, that's a lot,
Yeah, and that's the thing, is it's so frustrating when you're running for training for a half marathon, you're doing, and they're like, you have no willpower. And that's what's so frustrating. So many people we talk to, Tro, and it's so frustrating, is that they've lost 90 pounds before and they gained back 110 pounds. They lost 60 pounds. So they had to have willpower to lose 60, 90, 80, whatever pounds multiple times in their lifetime. And then we get knocked off track. And that's what we're trying to figure out, is like, how do we get on track and stay on track? So for you, what was your motivation? What was your why? Like, what made you go, okay, I'm jumping in and I'm doing this thing no matter what my friends, family, doctor, whoever says?
Well, me and my husband talked, and I tried everything else. I tried so many different things, calorie counting, Weight Watchers, diet pills, you name it. It's a very familiar story. I tried everything, and he's like, you know what? What do you got to lose? What do you got to lose? Let's try this one more thing. Let's see if this low carb, ketogenic lifestyle is something that's going to help you. What do you got to lose? So we had that conversation, and it was the best decision I ever made, and I'll never look back. I'll never look back. I'm so thankful for finding this way of life. It changed my life forever.
So who's your inspiration? How'd you start? What was your, like, first thing I'm doing is giving up this?
Oh, well, going to the low carb doctor that I went, and him telling me that I had a carb addiction set me free. I knew that there was hope, there was hope, and I could win. Other people had battled addictions and won, right? So I could win. I could win if I just put my mind to it. And I did. I had to take in new sights, new insights, new thoughts. I had to heal my brain, and it started to heal right away. Like, my fatty liver was gone within 3 months. I was told I'd never get rid of that. That was the cards I had been built. We did tests to make sure that it was gone. We started with eliminating sugary drinks. Eliminated all that out of our household. Sat down with my family, told them that I was sick and I needed help, just like an alcoholic or a drug addict. But my drug was carbohydrates and sugar, and we needed it out of the house. So we cleaned out the house. And, you know, the kids, they had safes in the rooms. I'm like, if you bring that stuff in, you got to hide it because I'm going to get it. So, and then,
Well, yeah, that's such an important thing. And so, you know, I just read a book called Endurance, and that's kind of the journey we're on. And endurance is like going through hardships and trials and still moving forward and all that. But the point is, if you look at Survivor, you know, people go on Survivor, no one gains weight on Survivor Island, right?
yeah,
If they want cookies, no matter what, you can't get cookies. Doesn't matter how much you crave it or want a pizza, unless you win a prize and you get it like once when you're there for 6 weeks or something. But it's that thing is what you did is made an island at home where you go, okay, it's just
yeah,
not going to be available. If I want it, I'm going to have to drive to the store and get it or go somewhere else to get it. And that's a hassle. The more inconvenient we make it for ourselves, the better off we are.
yeah. I just had to protect myself from myself by making all my environment safe. And that was the first thing. That was my first step in making my environment safe. And some things I just didn't go to because I wasn't strong enough. And that's okay, because I knew that it was helping me, you know?
Well, that's what Tro and I have been saying all along. It's like, look, we know what makes failure. We can see that pretty clearly. Lack of family support and stress. Those are the two big ones. And with stress, sleep, all these other things come into play. But if your husband says, I'm going to eat pizza and cookies in front of you all every night, then it's so hard to make that lifestyle change. It's just like if someone's trying to quit alcohol, you don't drink in front of that person or take them to the bar
Right.
every night. So it's
Yeah.
amazing. That's a testament to your family of saying, okay, we're on board. We'll get rid of all the bad stuff because you don't need the temptation. If you and if we're talking about addiction, then that's the problem is if you have stuff you're addicted to around your is by definition is an addiction. It's not just a desire to have that, you know, like some people like they can't sleep if they know there's a cookie in the refrigerator. Rob Sivas being one of them, right?
Yes. Yeah. Yeah. And I don't know. I just protecting myself from myself was really important, and having the family support. A community is important, to have a community to reach out to, and not and asking for support in the hardest of times, being able to ask for support, which I had never done before. So I started asking for help, you know? And I just want to tell anybody out there listening, ask for help. There's people that believe in you. And this is a great community here. The low carb community is so great and friendly, and the support is all around us. Yeah. I had to start bringing my own, you know, items to functions to make sure that I was protecting myself. And then the next thing you know, everybody's like, oh, are you going to bring that? Are you going to bring that? Because they wanted to eat the food too. So it's good to be an example for others. But taking control of my own healthcare was the best thing I ever did.
You know, I'm curious. So you know, you get this idea of food addiction, and this idea, right? It starts making you question. You know, you're saying I needed to protect myself from myself, right?
Mhm.
And I wonder, you know, I know what you're saying. You're saying like
Yeah.
some of your thoughts, maybe, you know, like these thoughts you've had since childhood, like maybe I should finish my plate, like that needs to,
Yeah.
some of those feelings of like shame and guilt, well, that needs to go. That excessive self-blame, like I'm just a dumb, you know, I might as well finish the plate and I'll fix this next week or next month or whatever. That needed to go. You know, but do you think that those are really parts of yourself? You know, do you think that that was who you were? You know,
No, I just think I had a brain disease.
yeah, right.
You know, I need help all the time for the rest of my life, and I'm okay with that because I have the tools now to help me. And I think proper nutrition is the first thing to heal your brain, and low carb saved my life.
yeah, and walk me through that transition because you say it so easily now, and I know what you're talking about, and Brian knows what you're talking about because we have felt it personally, we see it clinically, but that couldn't have been one, you know, one like you say it so readily. How
Yeah.
did it go? You know, how did it go at first? How were you challenged? You know, how did you learn to fight those sort of voices, those old voices you had, or was it easy and you were just like, nope, I'm addicted. I gotta say no, I'm done with this, never
Uh,
gonna do it again. Like, what was it like?
In the beginning, I was on fire because I saw changes right away. I eliminated carbs and sugar as much as possible. I didn't ever count anything, so it was easy, right? I kept it simple. Um, I saw weight coming off and medications being described, deprescribed right away in the beginning. So that was a beautiful thing, and it inspired me to keep going, and not give up. And if I did mess up, because you do, no one's 100% perfect all of the time. You just get back on the very next meal. You don't wait for another week or another month, because that could turn into a whole year. And most of the time, if I messed up, I would just come clean and say, hey, fam bam, I did this, I ate this, what, help me get back on track. If you see me grabbing something I shouldn't be, just say something.
Those are all huge points, by the way. With our groups, it is incredible. Like I know what Tro's doing with small groups, what you're all doing with small groups. When we have our community meetings, the people who are there are generally the ones who are killing it because they're doing great. The ones who are falling away, that are embarrassed, or that, and it's like church, they don't want to go because they're not living the life they should be living, or Alcoholics Anonymous or whatever it is. So what I find is, when someone is transparent and says, I've been struggling, I had a horrible week this week, I got into a fight with my boss, and then I went home and had a cake or whatever, everyone's supportive because I was there. I know what it's like. Yeah. And that you feel so much better that you're not the only one struggling, because we feel like if I eat that cookie or I go off track, then I'm a bad person. And
Right.
no one wants to talk to me anymore, and I'm out of the club, that kind of thing. And it's exactly the opposite. People want to help you because they identify, we all know how it is, to sneak food, or to feel like, you can't stop eating, you're hungry all the time, or you have that kryptonite food that you can't stop
Yeah.
eating, and to be out of control. But to have people say, here's what I did when I was going through that. Here's what I did when I was snacking after dinner. Here's what I did when I ate at 2 a.m, whatever it is. And then you give each other tools. And it's so helpful to see in follow up when someone says, 2 weeks ago, when this person said this, totally helped me, got me on track. And everyone gets rewarded that way, to see it. It's so amazing to see someone get back on track, right? We all
Yeah,
fall at
I
some
think
point.
so. And I think just take one meal at a time. In the beginning, I took one meal at a time, one day at a time. I'd tell myself I can do this for one day, and I'd get through the day. But just filling myself up, I started out with 3 tasty, high protein, fatty meals a day. And then eventually I didn't want breakfast. And I found out that breakfast wasn't the most important meal of the day. And I wasn't going to die without it. So I just consciously, just an hour at a time, would push that meal back. And this way of life, you're not as hungry. You're not as hungry in the morning. I don't know. There it could be other instances where people need the opposite, breakfast, lunch, and no dinner. But for me, lunch and dinner became my norm, eating 2 tasty meals, and then not snacking. That was a big deal because I had been accustomed and used to snacking all day long. So that was what and in the beginning I did use replacements, and I did use fat bombs to get me through to the next meal. Now not so much, because I don't want to deal with 2 and 3 days of thinking of it afterwards after I do. So I did use harm reduction and like lookalike foods for probably 3 years, 3 or 4 years. Was very important.
Can I ask you a question? Brian, I know
Yeah.
we've done this before, and
Yeah.
everyone's got a different opinion. Brian, are you a harm reducer or abstainer? Or both? Tia, sounds like you were harm reduction and now abstainer.
Mhm.
I'm still a harm reducer. But I should take that back. you know, if it's truly harmful for me, it will be gone, you know,
Yeah.
gone. So I should say I'm both, but I'm curious to hear each of you.
Yeah, I think it's really individualized. I think it's really a slippery slope, and it's hard. You know, Vinny Torture just came out with a documentary called Dirty Keto, and he says, look, we can't, and I get what he's saying. We can't just say, you know, I love brownies, so I'm going to make keto brownies, I'm going to make keto cookies, and your whole life is about making all these things that are processed foods, right? And you go, okay, harm reduction. Tomorrow night, I'm going to my friend's having, of all things, a dessert party. So I'm bringing keto dessert. So your wife, Rosette, has helped me out so I can make some cool dessert to have for myself. Guess what generally happens? Like what Tia is saying, everyone wants that dessert because it tastes great and everyone enjoys it. So there's times when you go, okay, look, if it's your birthday or someone's birthday party, you're going to a celebration, you want to be part of Christmas, holidays, Thanksgiving. There's keto versions of these foods that we can do. They're going to be a lot better for us, right? We don't have to have the yams and all the other stuff
Yeah.
that's. So I think it's an important thing, especially for people who've struggled their entire life. Sometimes having those options for a while, then with time you go, you realize I really don't need brownies to be happy, right? I really
Yeah.
don't have to have those things. I don't have to have dessert every night after dinner. And there's tricks around that, but I think ultimately we have to each determine for ourselves if we can moderate certain things, right? If I'm an alcoholic, I can't moderate my alcohol by definition. So some people, you know, they can go, hey, as long as I can have a piece of pizza every month, once a month, I'm good with that. It really depends on the person. And one person will have one piece of pizza and they can't stop for a month, and
Yeah.
they're eating everything in sight because it's one of those things where we see it as a failure, or we were weak, or we have no willpower, and then we believe these lies that we tell ourselves, right? That you can't get back. Like what you're saying is, you get back the next day and get on track and do your thing. Great. Some people can't. So it's really for each of us. It's really because I've changed my position on this because I've never liked, you know, like Rob Sivas' approach is that you're all addicted and you can never have a cookie again, or you're gonna like, and it's a hard approach. It's a hard line, but for some people, that's the truth, and for other people, it's like if I can make that choice, and I think an important thing for all of us, you can look at your favorite donut and go, is it worth it or not? It's not worth it. But if Trobe made me his special donut that I have once a year, who cares? It's not a big deal. It's not the end of the world. So it really is for some people. If you, and this is where I was talking to Vinny about, if you set the bar too high for you, if I set the bar too high at the beginning, go, look, you're just gonna eat salmon the rest of your life because that's the healthiest thing you could possibly eat. So you're just gonna eat salmon. You're like, I don't want to live my whole life eating just salmon. I want to have something different on my birthday, and I want to do something different during the holidays. So when you set the bar way too high, but what you do is we slowly raise that bar. I think a lot of it, like what you did, you raise the bar slowly and you go, I really don't have to have these things. But at the beginning you did, maybe just to get you
Yeah.
on track and saying, if I could bake some kind of healthy bread, then let me try that first and see how that works, you know? And so I think a lot of people make that decision of saying, if it's store-bought, I'm not eating it. If it's store-bought sourdough bread, I'm not having it. But if Tro bakes his sourdough bread and I have it once a month or once a year, okay, right?
Yeah, I like that because it did help me in the beginning. And I do still make. Rosette has wonderful stuff, and I make it. I buy it and I make it and I bring it to all my events. And everybody always goes for it. And they're like, will you bring some more?
You know what?
I'm like, see, you can eat healthy too.
Yeah, when we were on the cruise, Rosette's little, like she had little, like I was like, oh my gosh, the pistachio
You know,
Those
biscottis
are
or something
good.
with a little coffee, and I was like, this is nice, right?
so harmful. Like, you know, I don't want to put out stuff anymore. Like, you know, I don't want to put out flour. I don't want to put out sugar. Like you know, it's like I wouldn't put out cigarettes. You know, I
Yeah.
wouldn't put out like, you know, I wouldn't put that out. I wouldn't put like opium out or cocaine plates, you know. So I don't want, like, I don't mind, but like I feel, you know, like to use almond flour, it's just like it's not that hard, you know. It's slightly less addictive. It helps anybody. It tastes better, you know. I'm
It's
just
actually fun. It's actually fun to make a different spin on your favorite items and know
yeah.
it's a healthier choice.
I mean, I have a you know, a family that's coming over later today, and their 12-year-old has type 1 diabetes. Like,
Oh,
I'm excited to like make this kid a pizza.
yeah.
You know, I'm excited, and it's going to be almond flour. It's going to be butter and cheese. So, on one hand, but for me personally, and I tell Brian this all the time, I don't eat that stuff. I don't eat it. I don't want it. Brian saw how much I ate on that cruise. You know,
The waiter, man, that waiter's looking like, come on, man, I can't waste the food. And I'm like, he's gonna eat it all. The waiter's like, I'll bring you a couple at a time and we'll see. And then the waiter's like, the next night he's like, okay, what do you want? I got it. Yeah.
Yeah.
No problem.
so like when you have a drive to eat, you don't want anything to be too good,
Yeah.
right? Good is gonna
Right.
stoke that fire and keep you going. So I don't eat that stuff, but like once in a while, I mean, that's certainly what I turn to. Brian, did I surprise you? I'm just curious.
Yeah, you surprised me, man. I'm like impressed. And the funniest thing is on Twitter, or Tro was talking about it, this guy's like, you're such a liar. Like, you couldn't have possibly eaten this many. I'm like, he legitimately did for sure. No question.
Oh, hey,
Like,
he took me to a Brazilian steakhouse when I was in New York, and he can eat.
yeah, Tro can eat, man. He can eat. I mean, I was actually pretty surprised. I mean,
Yeah.
one of these days I might try that experiment, Tro, to see what happens, but I think I will gain 20, 30 pounds pretty quickly.
I tell you, Brian, I think what the reason why we didn't gain weight, and first of all, a plug out to Debbie Hubs, right? And I have no
And Michelle, the whole team, they were amazing. Amazing.
relationship with that group. We just love, both of us, I know, and our wives absolutely love that low carb cruise. And we cannot wait to go next year. In 2025, they're going to Alaska.
Oh,
So just a huge shout out to them. We have no financial relationship, nothing like that, but we are huge supporters. What a great event and what a great time it was. So anybody out there, but yeah, that's where Brian saw me eat. I think really
yeah.
good.
I think you guys should be required to bring your whole staff on the cruise.
I know. I think we should too. Yeah, it's
Working
an
on
amazing. It was a Tro and I. We had so much fun. It was great. Just talking to the people there and the vibe. Everything was so great because this is what they talked about. Like, okay, how do I like your stories? Like, it's so important that we get back to this. Low Carb MD is coming back to this of saying, okay, who's the next Tia? Who's the next person who's really given up hope? And yeah, like, you're on 20 meds or you're on tons of insulin. So this is what's important. People need to hear stories like yours, not what the latest science on ketosis for the brain is. I mean, that's clear. We're seeing that, and these are things that when Tro and I started this, how long has this been now, Tro? 6 or 7 years now. We were trying to figure it out, but back then when we talked about mood stuff getting better on low carb and keto, it was like hate mail was coming from all sides of doctors saying, how dare you? You should have your license revoked. Now the data's on our side, right?
Yeah.
So, and your stories, I mean, all the people are not making these stories. I remember with Sean Baker when he was saying that all these people with carnivore, they start getting happier and they're getting along and their joints don't hurt and everything. It's so over the top that it was hard to, even for me at the time, was hard to really say, is this true? I mean, can it be? And then we
Yeah.
start seeing it over and over and over again, and it's pretty remarkable. And then you wonder how many people like yourself, if you didn't make that change, where would you be now? We're talking about amputations and kidney failure and depression and suicide, right?
My vision too. My vision was changing. I have several glasses, prescriptions. It was crazy. All the improvements that, I mean, I'm just not hungry and have cravings like I did before. It doesn't consume my thoughts every day. I can handle social situations. I know when I'm stressed that I need to protect myself with, low carb foods for days afterwards. So I know I'm going to be okay.
What did you do? What was the big thing? Because this is really important for people to hear too. Like, your go-to before when you got stressed or upset or had a bad day or were sad was food. So what do you do now? You had a hard day, someone's mean to you at whatever, at work, or now that you're working with Tro, that's probably going to happen more. But
I know.
I'm just kidding.
That was
But
awesome.
No,
but what
you're
do you do? What do you do at that time?
I take a walk. I go out and I walk my dog. I might call a friend on the phone. I might, we have 60 chickens. Go out and feed the chicken. I like to use a coloring app on my phone. Anything to take your mind off the moment. Put a puzzle together. I might read a book, or I might listen to Low Carb MD, while I'm on a walk. Those are the things.
Desperation. Wow.
Yeah, no.
That
And
was
of course,
crazy. That was
yeah, I
crazy.
love,
That would raise my blood pressure a little bit right there,
yeah, it is an awesome podcast, and I love Life's Best Medicine.
Oh,
Another one of my
thank you.
favorites. Yeah, and Tracy McBeath, is my very good friend, and I love her podcast as well. And you have today.
Yeah, there's
Just
some great
her in.
ones. There's some great ones, and it's so good. I think letting your brain think on these things and hearing good stories, and it's so important, especially these days when there's so much negativity and hatred
Yeah,
around us. But to have these positive stories and people overcoming like yourself, I mean, that's a huge deal. Just to help someone else who's struggling. That's the people we want to help. Were so many of these people that were like 500 pounds, and they go one step at a time, and they did it. Like, how do you do that? Like, how do you even start when you're like, when you're on an insulin pump? How do you even start this kind of journey? Like, I mean, I'm sure when you started this, you had expectations, but now where you're at now is like exceeded all of your expectations that you thought were possible at the time.
it's a miracle. And I, staying consistent and getting back on the very next meal, and having a community of people that, like I said, believe in you, that know you can do it, and encourage you and help you through the hardest of times, is beautiful. It really is. I mean, I've only been part of Dr. Tro's community for a little while, and the people there are just amazing, and the support that they give is off the charts, incredible. Having people that are like-minded, just, to share with. Not only your struggles, but your wins.
Yeah, 100%. I think, being able to also know that a team is walk to walk. Like when you go to Brian's practice, when you come to my practice, when you come to when you go on the app, there, like, you're in a community of people who struggled the way you have, who want to, who know their intended solution, that's in line with you. It just makes it easier. It just makes it easier. And then having, this was a big thing when I started. I was like, every day of the week, I want somebody to be able to go somewhere. Tuesdays, we have a meeting. Wednesdays, we have a meeting. Thursdays, we have small groups that people can attend, which, people can sign up for. And then Fridays, they can come to this podcast, go on the, listen to it live, ask their questions. I mean, that's the, to have that touch points, like in a way where it supports, your long-term goal. And it's, and a medical practice, I mean, that has health coaches and training, and like, being able to, it's a combined effort, it's a combined, like, you're not alone,
No.
like when you went to your doctors, all I hear is, I was alone. And you were, I'm sorry, like, that should be malpractice, what they did. And me and Brian, for the last 6 years, we've faced people telling us we're doing malpractice, right? That should be malpractice, and that's normal. People think that's normal. It's not normal. It's abnormal. And it's not a service. And it has been so hard for me and Brian to be interest-free, right? Commercial-free, right? On this podcast, right? And to be able to help people in our practices without, insurance giving us incentives to give people novel therapies, right? And Brian and I have, it's been awesome. Like, look, we get to go on these low carb cruises and low carb conferences. And now I get to work with you. We saw, a patient today. We saw a patient earlier this week together. And, you know, but it has been so hard for us, you know, and it's all of the listener support that's helped us make this happen.
Yeah, and it's such a small, like Tro and I were just talking about this, reflecting a bit while we were on our cruise, right? The Patreon supporters is such a, it's less than 1% of our listeners, not even close to 1%. So these 1% of people, thank you for your support. They're here now with us. They've kept us floating because Tro and I don't want to have to dig into our pocket to make this happen every week. And we want to make sure that we can get, you know, the best editing and get little clips out there because we want to reach more people. That's been our vision. That's been our goal for this. And we never take a dime from this. We put money into this podcast, right? So people go, oh, these guys are doing this podcast to make all this money. Well, we're not. It's actually taking, we could be working, seeing patients right now, right? But it's so important for people to hear this story because in our offices, we can only reach so many people. With this podcast, we're on 10 million downloads now, right? And so it's so important what we can do for the community and bringing people together and sharing your story. Because if no one hears your story, if there's not a platform for people to share, then no one knows. No one knows that there could be hope for them. So that's why it's so important to have you on and have you as a coach, because if I struggle with alcohol, I don't want someone who's never had a drinking problem to counsel me. I want someone who's been through it and struggle and go, yeah, I'm in the fight still, and we're all still in the battle. So it's not like we've all arrived. We go, I'm still struggling, trying to figure things out myself for me. And so let's work together and see what works for you and try different things if we have to, pull different levers. And that's what's great. We've all done that. And we've all gone off track and we've all got back on track, and we figure out, like, how does this work ultimately?
Yeah, it's crazy. I mean, I had type 2 diabetes, non-alcoholic fatty liver, depression, gout, acid reflux. All these things can be healed with proper nutrition and with doctors such as yourselves, incredible people to help us get off the medications. I just hope that everyone out there can know you can do it too. I'm not a special unicorn.
Well, you are a special. You are special. And that's why you're with us. But you're right. Like it's many people, I'd say in my practice, I would estimate 80% of people can live a drug-free, medication-free life. Look, the reality is sometimes we have sepsis, sometimes we have heart attacks, sometimes we have severe things, sometimes we have conditions where our livelihood and our lives, our relationships suffer, and we need medication, but it's exceedingly rare. And the problem is what you faced. You faced a system of doctors that feared you, shamed you, and just wrote pill after pill after pill. And nobody said, wait a second, you have another problem here. Maybe you have an addiction to food, right?
Yeah.
Maybe sugar is like literally not good for your brain. We know it with kids. We all see it. You give your kids, what happens? They become monsters. I mean,
you sleep deprive them, give them candy, right?
Yeah.
Stress them out. Like it's a disaster for all of us. And
it's not a leap to say, like, hey, maybe you should try that. Try that first. Like,
And that's the hard thing, Tro. Like for me, just looking around society, I look at people that are grumpy and tired all the time and have no patience. You go, man, I wonder how much of this is lifestyle and diet and mindset. Because if you're not happy with yourself, you don't want to uplift other people. So that's why we see so much negativity. And one of the interesting things I was reading about the downsides of weight loss, and one of the biggest downsides for people who have sustained weight loss is criticism from their family and friends.
Yes.
Right? You're too skinny. You should have done this. You're too enjoy life. Why? And it's so hard because this is the resistance we're up against. So, you get your momentum going. Now you get resistance slowing you down because you start doubting because your doctor's saying, this is crazy what you're doing. You're going to die. And, and I wonder over your time with all the meds, everything going on with you, how many doctors sat down and said, how's your lifestyle? How's your sleep? How's your stress at home? you know?
No, none asked me those questions. And I'm glad you said something about that because people did. I was working in the hospital setting for 15 years. And so people did witness my journey and how I lost weight. And people at one point did pass me in the hallway and say, "Now, Tia, that's enough. You're gotten too skinny now." And I'd be like, "Well, I feel good. I, I feel good. Why would I stop doing what I'm doing now?"
Yeah, and you're clearly not a fanatical person over the top because you can get to, you don't have
Yeah.
to run 30 miles every single day. And, some people can get really caught up in this where they're obsessed and they can't enjoy their life, so finding that balance that works for you and it's working and you go, okay, this is acceptable lifestyle for me.
Mhm. Yeah, but just to think if I would have had someone say, "Hey, let's sit down and talk about what you are eating. Let's look at your daily, consumption. Maybe we can switch it up a little bit."
I mean, I can't tell you, like, that's what's needed. Mark Cucuzella says this all the time. He says, our job is to take people out of the gutter, right? And you are in a
Yeah.
medical gutter, right? I don't know how it happened, a system of stuff that happened, adrenal, like all these things. And somebody was like one medication after another. We had a case of Cushing's in our clinic, and we got this patient off of 3 medications, right?
Yeah.
Got him off 3 medications. We handled the Cushing's the way it should have been handled. By the way, that patient went to a hospital, okay, went to 3 different doctors, including a cardiologist, and was told to go on a low salt diet to deal with his blood pressure.
Me too. Low
Turns out
salt.
it turns out he had a brain tumor that they all know,
Oh,
right? And this is the thing is that, and they were patient to drop keto diet and go on a low salt diet for, blood pressure, right? That was the cardiologist, right? And the problem is we have to get docs, I think, critically, deeply. And, and I know you didn't mention it, you're part of the SMHP, you're on
yeah.
several committees there, you volunteer there. I mean, all of these things which make it's easy for me to say, I'm just happy, honored to work with you. We need more people like you whose lives have changed, who are committed, who give back.
That's one of my most, I'm most proud of myself for that accreditation. Doug and Pam are amazing, and the community is like family. You go to a conference and you're like, "Oh," and everybody's hugging each other and asking how you're doing and how your life's going, and it's just the best. And you guys are also approachable. You'll take a selfie with me.
Yeah, Oliver, all the docs. I mean, everyone out there,
Yeah.
the coaches, everyone is so approachable and so nice. And that's what drew me to the community also. Like, Jason Fung wasn't saying, I'm going to keep all these secrets to myself. Let me teach you what I know. Let me teach you I've experienced over the years. And so all of them, one after another, I would reach out to them and they would get right back. And so it's amazing to see that. And I've learned so much. I mean, this is so important. Like my talk that I'm giving at the symposium for metabolic health in San Diego, like a lot of the stuff I learned from health coaches and people who are dedicated, and I go, wow, I never thought about from that perspective, maybe like talking about our strongholds, the lies we tell ourselves. And until we figured those things out, like you can understand, like so many people, they understand the science, they know all the data, but they're collecting data from everywhere. And they can never
Yeah.
start the journey because they're collecting data for 5 years while they get sicker.
Yeah.
And so how do we get that inertia to say, okay, now I'm going to put this into practice, even if you don't, like you said, you don't do it right, you have training wheels at the first till you learn, and then once you could ride on your own without the training wheels, you get rid of them. Right? But sometimes you need those for a little while so you don't skin your knees and fall off and hurt yourself. So it's all these things, all this wisdom that we're all getting. And so what Tro's doing is so amazing, having health coaches and people who are experts, counselors, and figure out all these problems, because it's not just that you enjoy cookies. There's so much more to it. So people overcomplicate it for sure, but also we we don't pay enough attention to those things. Like, okay, what's going on? Where's your stress level? Because stress affects all this, and not sleeping. And, you know, we just say, if you're stressed out all the time and you're eating keto and you weigh yourself 6 times a day and you're frustrated all the time, that's so counterproductive. So we have to figure out, how do we address all these things, not just keto, not just low carb or whatever. You know, I think it's a huge story, and we're all individual. So we all have to figure out for ourselves what works. And I think, you know, the other morning I woke up at 2 a.m. I'm thinking of Etch-a-Sketch. I'm like, what the heck is Troy? You probably are too young, don't even know what that is.
I do.
The two little things, but the Etch-a-Sketch, you try to do art, and these people do amazing art. Like, some of these pictures are amazing, but the thing is, you could just shake, when you screw it up, you just shake it and you start over again. Like, every morning we have a new start, right? I know we blew it yesterday, but today's a new start, and we can get back on track and make your art with your Etch-a-Sketch. And if you screw it up again today, shake it up tomorrow morning and start over again.
Love it. I love it.
You know, I mean, we get so caught up. We worry about what we screwed up 2 weeks ago or a month ago, and we don't focus on today. And we live in that, right? We got to get out of that somehow. And that's what you did. That's what Tro did. That's what I'm attempting to do, you know? And so, you know, it's just really, we can't go on this journey with all this negative self-talk about, like you said, how many diets you lost weight and gained your weight back, or you didn't have success. And you keep doing it till you find what works for you. And if you find that this isn't working, then you go on to the next thing. You know, some people do carnivore, some people do low carb, some do, and it just depends on where you're at in life, I think, and your metabolism and your other, you know, career, stress, marriage, relationships, all these things. It's a huge, huge deal. So we're proud of you.
Your thoughts can't make you do anything, right? Your thoughts can't make you go eat that cookie. So sometimes if you just take a pause, it'll go away. It'll pass. If you get up and do something else. Getting back to the SMHP one more time, the resources online are incredible. You can print off therapeutic carbohydrate clinical restriction and give it to your doctor. There's a handout on CGMs, on insulin resistance. It's really great. Anyone can go on there and print those off.
Yeah, there's a lot of great resources there, and also practitioners who are certified, like yourself and myself. I finally did it, Tro. I did all the.
Oh, I approved your application.
Oh, you approved me, Tro? Oh man, I'm surprised you didn't reject me, man. I did the ethics course, listened to the whole thing. I did all that stuff. But anyways, but they're doing great work, and you know, having Tro part of that and approving my application, that was nice. Yeah, but really, the grand rounds they're doing a lot of great research. They're contributing a ton. So that's what I mean. There's so many people that are doing good work, you know, like, and we've already mentioned the low carb crews. They're doing great work, and they're so dedicated to what they're doing. So anyone like that, we want to lift them up and give them a platform and help them out any way we can, because we know they're helping other people, and those people are going to go help other people, and you kind of expand this thing, and it takes a lot of effort. You know, there's a lot of people doing a great work behind the scenes.
Absolutely. I cannot say it. I'm going to say it again. You know, a lot of things coming up. You know, we have a small group that's taking people. We have a July mindset lecture. Brian's going to be lecturing at Low Carb San Diego. Tia is going to be lecturing in Tennessee in late August as well.
I'm excited.
A lot of ways to get involved, and the SMHP is always looking for people to get involved. And we'll have all the links in the notes. And I just want to say before we part, thank you again to all our Patreon supporters. People who go to Patreon, go to lowcarbmd.com. They click on the link to go donate on Patreon. It's you guys who keep us going, and we just appreciate you all. And we've just had a great time for this past 6 years, and we want to keep going.
Amen. Tia, you have any words of wisdom on our way out you want to leave our people with?
Change your food and you can change your life. And join a community. Join a community.
And how do people track you down?
At towardshealth.com with Dr. Tro.
All right, and Tro, tell everyone about your talk, that this talk that you're doing, so we can like sign my patients up and sign me up for it.
Yeah. No, I mean, it's more about it. Well, maybe we hear more about it. It's a 4 hour, it's a 4 hour lecture series. It's myself, Amy Igus, Dr. Laura Buchanan, Tori Jones. She's a mental health counselor, and we're talking about the
Awesome.
mindset. It's all about mindset. And you'll hear different angles on how to make this sticky upstairs. How to make
Yeah.
lifestyle sticky upstairs, which I think, we don't really get to hear about often. You hear about the science a lot, and we talk about the science, but I think sometimes being able to just get to the nitty gritty of what are the things holding you back and how do we conquer them. I think that's the sometimes that's really helpful. I'm excited, guys. Maybe next time, Brian, the next time we do this, you and I got to do a talk together. That's what we got to do.
That would be
Yeah.
great.
That may
links
happen.
are
That may
down.
happen. That may happen in Alaska if I can drag you there again, Tro.
Yeah, no, I want to go to Alaska.
We were supposed to do it one time. Remember, we were supposed to, and you got sick or something happened, and
Oh, it was COVID. They locked New York down.
oh, they locked New York down. But I
Yeah.
escaped California to go there. But
Yeah.
you know,
Oh,
Guys, thank you so much. Thank you, Tia Reid. Thank Brian.
Right.
As always, it's a pleasure.
thanks, everybody.
Thank you to our supporters. We just appreciate it. And if you've loved this podcast for the last 6 years, go out to our website, lowcarbmd.com, and then click on that link to Patreon and give us your support.